Assalamu alaikum everyone. In our previous videos, we have talked about the fetal lie, fetal presentation, fetal attitude. In this video, we will talk about its position, the normal fetal position and abnormal fetal position, that is called malposition. Now, in order to understand the fetal position, you should know that what is the denominator. As we know that the normal presenting part is vertex. In my previous video, I have talked in detail about the presenting part. The link of that video is present in the description box. Now, as we know that the normal presenting part is vertex, if during labor you do vaginal examination and you feel that there is a vertex presentation, then you should know its position. In order to tell the position of the presenting part, first of all, you have to choose a bony landmark. In case of the vertex presentation, you will choose the occiput. Either it is towards the anterior side of the pelvis or it is towards the posterior side of the pelvis. So what is denominator? The denominator is a bony landmark on the presenting part used to denote the position. So first of all, we will talk that what is normal fetal position. In simple words, if we divide the maternal pelvis in two parts, this is the posterior part and this is the anterior part. First of all, we have to tell the presenting part. If the presenting part is vertex, then you will choose the occiput. And if this occiput is towards the anterior side of the pelvis, we will say that it is a normal position, that is occiput anterior. So one by one, first of all, you should know that if fetal occiput is towards the anterior side of maternal pelvis, it is called occiput anterior. If occiput is present directly behind the pubic symphysis, we say that it is direct occiput anterior, and if this occiput is present towards the anterior side of the pelvis but is slightly away from the center in such a way that the occiput is slightly towards the maternal right side. So this is the maternal right side. It will call as right occipito-anterior. If occiput is towards the anterior side of the pelvis, but it's slightly away from the center in such a way that the occiput is slightly towards the left side of the mother, it is called left occipito-anterior. So how easy it is. So what is normal fetal position? The normal fetal position can be occipito-anterior or the direct occipito-anterior, or it can be right occipito-anterior and the left occipito-anterior. So if in auscultation the examiner asks you the normal fetal positions, you should know these three. Other than these fetal positions, all other fetal positions are abnormal. So now we will talk about that what is malposition. As this is the right side of maternal pelvis, this is the left side of maternal pelvis, this is the anterior side of maternal pelvis, this is the posterior side of the maternal pelvis. If occiput is towards the anterior, it is a normal fetal position. If it is towards the posterior side of the maternal pelvis, it is called occipito-posterior. But if it is halfway between the anterior and the posterior, it is called Occipital Transverse. Now, if occiput is directly behind the maternal sacrum, it is called occiput posterior or direct occiput posterior. Now, in right occipito-posterior position, the occiput is slightly away from the center, mean occiput is behind the right sacroiliac joint. So in right occipito-posterior position, the fetal occiput is slightly towards the right side In left occipito-posterior position, the occiput is towards the posterior side of the pelvis in such a way that the occiput lies directly behind the left sacroiliac joint. In left occipito-posterior position, the occiput is slightly towards the left side of the mother. So direct occipito-posterior, left occipito-posterior, right occipito-posterior are the male positions that will cause the prolonged labor or the obstructed labor. Now, if occiput is halfway between the posterior and anterior, it is called occiput transverse. In right occipital transverse, the occiput is halfway between the posterior and anterior position with occiput towards the right side of the mother. In left occipital transverse position, first, the occiput is halfway between the posterior and anterior position with the occiput towards the left side of the maternal pelvis. So in a nutshell, occipito-anterior or the direct occipito-anterior, right occipito-anterior, left occipito-anterior are the normal fetal positions, while occipito-posterior, left occipito-posterior, right occipito-posterior, right occipito-transverse, left occipito-transverse, these all are the male positions. Now the test time. If you have watched my previous videos, in that I have talked about the fetal lie, the fetal presentation, fetal attitude, and in my this video I have talked about the fetal position. So first watch them. Then you have to answer me the following questions. The image is given. You have to tell me that what is fetal lie in this image. What is its presentation? What is the fetal attitude and what is the fetal position? You have to write the answers and post it in the comment box. Thanks for watching.